Okay, this is my presentation on an eating disorder known as pica. So, what is pica? Pica is a psychological disorder where individuals compulsively eat non-nutritive substances, including things like soil, dirt, or clay, which is known as geophagia, paint chips, which is known as plumbophagia, raw starches, such as for cooking or for like soap starches, known as amylophagia, ice, known as pagophagia, and hair, known as trichophagia. So the DSM terminology and criteria have these characteristics for pica to be present or for it to be diagnosed to someone, which includes 1 month of persistent consumption of the non-nutritive substance. Consumption is also inappropriate for a developmental level, um, not part of one's culture or social practice. And if consumption is not due to comorbidity or in alignment with another disability, then clinical attention is needed. So, for some clarification, consumption at an inappropriate level means that they have to be at least like older than 24 months because it's pretty common for children, ages from 1 to 2, to put stuff in their mouth or just to consume things without really knowing any better. So, after ages 2, then it's kind of a concern when children are eating these things. And for prevalence, overall statistics of pica are difficult to measure due to differences in the definition of what pica is or what is considered non-nutritive. So for example, something like ice is just water, but it's up in the air. We can consider it as a non-nutritive. Um, and the reluctance of patients to admit that they are eating these things can be sort of a vulnerable place to admit to therapists. So the overall risk of it is kind of unclear, but at risky ages, it could be anywhere between 8 to 65%. And we will see that impoverished communities in different countries have an increased chance due to these communities having food insecurity. So in some places, they'll eat things like clay cookies just because they don't have enough things to go around to eat, really. And pica is really prevalent among younger children and pregnant women. So among younger children, again, ages 1 to 2 are likely to engage in pica, which is respectively 75 and 15%, which again isn't much of a concern because this is just the point of their age where they're just kind of curious with stuff around them. But about 5% of school-age children are likely to develop pica, and children with intellectual disabilities have a 10 to 33% chance. Pregnant women are also at risk of developing pica. So again, in different countries, this can be varying. So the leading chances of pica are 44.8% in Africa, 23% in North and South America, and 17.5% for Eurasian pregnant women. So what are the causes for pica? I kind of categorize them into two sections or factors. So there are physical factors, which again can include pregnant women. Sometimes these pregnant women will develop these cravings. Pregnant women with food insecurity are especially at risk for engaging in this behavior. And pregnant women and children with iron deficiency and zinc deficiency are or have been found to engage in eating these non-nutritive substances. And then there are psychological factors, which include having a lot of stress, anxiety, or being neglected, especially at younger ages. Developmental disorders, again, are a risk for developing pica, and pica is also associated with mental disorders or conditions like OCD as like a comorbid factor to it. And environmental factors, like we discussed before, some consumption of pica or consumption of these non-nutritive substances is accepted in some communities where food is not readily available. So, why is pica concerning? Pica can cause several health issues due to the consumption of non-nutritive substances. So, intoxication can happen with children, because their GI system just isn't really refined yet. So a lot of the times, this intoxication can come from consuming things like paint chips or soap. And there could be gastrointestinal blockage or tearing, especially with things like eating soil or like clay or rocks. Subtle symptoms can occur, such as nutrient deficiency, which likely happens because they're not getting the right nutrients or eating other foods, because they're getting full on these other non-nutritive substances. And things like infections can happen when people eat dirt. There's a lot of like parasites or bacteria in them, so those are definitely things to look out for. And treatment for pica is dependent really on individual differences. So one approach is to look at it in a dietary way or a nutritive way. So for those with zinc or iron deficiency, providing sufficient supplements or dietary changes can be enough. And simply reducing exposure to these substances may also help. But on a more psychogenic approach, it's a little bit more difficult. So behavior-based treatment with positive reinforcement for healthy eating behavior can work. Medications like SSRIs have been helpful for those who do have pica, but it's not like an all-encompassing solution to it. It's just more of like if you have another mental disorder that's comorbid with pica, it might help. Aversion therapy to identify what's safe and unsafe to eat can help. And behavior assessments or cognitive behavioral therapy can also help identify what the triggers are. So, for example, a lot of times people will consume these non-nutritive things as a coping mechanism, whether it's just because they find it comforting. So, therapists will try to find, okay, like, what is it that is triggering you to feel like you need a coping mechanism, and how can we and the family try to help that out? And from then on, they can help create individualized plans. Here are my references. I used the NIH government website for some information, as well as our Lumen module about eating, feeding, and sleep-wake disorders.